Hi, I'm Greg, creator of opportunities.
And I'm Polly, princess of prevention.
And welcome to another edition of Totally Preventable. Welcome to the Newport County Prevention Coalition podcast, Totally Preventable, with Greg and Polly. I'm Greg.
And I'm Polly.
And today, conversations surrounding marijuana legalization have begun to pick up traction once again in Rhode Island. And with more dispensaries appearing in surrounding Massachusetts cities, we're left with more questions than answers about the future impact this will have on our youth.
Today, we are joined by our director of Newport County Prevention Coalition, Rebecca Elwell, to share a little more clarity on this topic. Before we start, would you like to tell us a little bit about what you do and how you got into this field of work?
Sure. Thank you for having me. I'm very excited to be able to share a little bit of information about marijuana with you today, because I think that youth use of marijuana is totally preventable. I started in the field of substance abuse prevention about 22 years ago. I had gone to college looking for opportunities to work in a field where I'd be helping people. Changed my major many times, from education to psychology to counseling, and graduated with a degree in counseling. And not long after that, a couple of years after graduating, I had a chance encounter with someone from my community. I was taking time off to raise children at the time, and she told me about this very, very part-time job in prevention. I had no idea what she was talking about, did not know there was such a thing as a field of prevention. And 22 years ago, it was barely a field at all. But I took the part-time job. It was about 10 hours a week. I could fit it in around my family, and I loved it. So 22 years later, it's turned into a passion, a career, something that I look forward to getting up and doing every day. And in recent years, since 2019, we are a 501c3 nonprofit organization that's really building and becoming a force in Newport County. So it was one of those things that it found me. I did not go looking for this, but it's been a great match. So prevention is often misunderstood, or people don't know what it really means. People think about the days of Nancy Reagan and, just say no never worked. But over time, in the beginning, 22 years ago, it was loosely associated work around helping kids to make better choices and live a healthier lifestyle. And, over the past 20 years, it's really developed into a science. There are best practices, there's evidence-based strategies. We know what it takes to work in a community and get everybody on board so that we're helping kids to avoid those things that really can have an effect on their later life, substance use, other at-risk behaviors, and there are strategies and ways of addressing those. And it's really fun to match up what is a best practice with what the needs are in a community.
Now, you mentioned working in the community. What are some of the biggest obstacles that you've found with trying to gather the community to get into this prevention work with you?
Yeah, that's a really good question, because I think that there's a lot to unpack there. One of the things that we struggle with is that we really want to reach out to parents and get parents on board and support parents. But there's a lot of reasons that parents are reluctant to kind of like join forces with us. One of the things I think is that traditionally the prevention field has looked sort of judgmental to, from a parent's point of view, a little bit negative, a little bit threatening, like, oh, gee, if I go and participate in a conversation about substance use, is someone going to look at me and think maybe I'm having trouble with my teenager, or maybe they're going to think that there's trouble in our homes. And the fact of the matter is, anybody that's raised a teenager, there's trouble in your home somewhere along the line. it's beneficial to have a conversation. And I'm just being, sort of half joking. Not every child goes down the path of using a substance or other high-risk behaviors. But truth is, most of us have faced that at one moment or another in our children's young adulthood or adolescence or teenage years. One of the things that I try to say when I'm talking to parents to get them, comfortable and not feeling like they're going to be judged, is that when our kids are born, we all have these conversations with other parents. And we talk about, how do we get them to sleep at night? How do we get them to potty train? How do we teach them to walk? All of the, little things. What's the, like, in nutrition protocols at any time when we're raising children? But sometime around middle school, we stop having those conversations. We stop talking about the new challenges and those new milestones that our kids are getting or not getting. We begin to feel like if we're having those challenges, instead of asking for help, we kind of shield ourselves or our children from that conversation. And then as our young people get into high school, it becomes even more protecting our child's reputation or our reputation as the super parent that we all want to be. And the fact is, if it was easy to be a parent, we'd have these perfect families, perfect children. Is not easy. And getting parents to have those conversations in the community, really vital. I would say the other aspect of getting people involved is that, as I just said, parents don't want to be involved for fear that they're going to be judged in some way. They're concerned if they are having those substance use challenges with their young people or within their homes, they don't want to share that. And then that window of time when they could be the most value to other people, to their peers, goes by. Your kids are moving on. They're getting big. And parents, then the adults in the community, sometimes, they're in a different place in their life. What we have found is more and more reaching out to those folks. If we talk about wellness, certainly the mental health needs of our kids. If we talk about how much the community cares about kids, we're very fortunate to work in Newport County. Newport County towns care. They really care about the well-being of their young people. You can tell it by the athletic experiences that our kids have and the art experiences, the really excellent schools. These are communities that really care about the well-being of kids. And if we can tap into that from that positive perspective, I think it's more likely that that the adults in the community are going to join forces.
Great. Thank you, Rebecca. On March 1st, the Senate committee held a hearing on the bill to legalize. On March 1st, the Senate committee held a hearing on the bill to legalize marijuana in Rhode Island. Under the Senate legislation, legalization of possession of up to 1 ounce would begin on October 1st, 2022, and sales would start then too, though it would be initially limited to existing medical cannabis dispensaries. In your opinion, do you think conversations about legalization often overlook the risks and discussion about support, such as prevention, harm reduction, and addiction recovery?
This is a great question, Polly. It does. It does. Again, I'm going to say some of these issues are totally preventable. We are talking about legalizing another intoxicating substance in Rhode Island. It's all about the money. Legislators are looking at this as the legalization of marijuana as a financial windfall. It's a revenue source. What is left out of the picture is the effect of legalizing marijuana on our youth. The Newport County Prevention Coalition has a marijuana statement, a position statement, and I'm just going to read it so I get the words correct. The Newport County Prevention Coalition works to prevent any circumstances or actions that increase youth access to marijuana. So the reason that this is so important is we hear when people are talking about legalizing, they throw every reason in there. Social justice issues, it gets rid of the black market, it decreases access by youth. These things have not shown to be true in the states within the US that have legalized. We in Rhode Island have a great opportunity to take a look at those states that have gone before us in legalizing and learn from their experiences, learn from their mistakes, and look at it from the perspective of, say, a state like Colorado, which was among the first to legalize. Marijuana use by youth has only increased. Access has increased. They talked about the black market going away. Oh, it's just going to go away. There won't be any illegal sales of marijuana. They're just going to walk into a store, purchase it, pay very, very high taxes. The state's going to win all this money and kids will not have access. Well, in Rhode Island, one of the things so that didn't happen in Colorado, mind you, but in Rhode Island, there's also provisions within the bill that will allow for people to grow their own marijuana. So if you're growing your own marijuana and you're sharing it with your friends, or maybe even making a buck to grow more marijuana, how are we taking the black market out of this? They sort of call that the gray market. In my mind, that does nothing but increase the access to kids and to everyone else. And it also decreases the likelihood that the revenue projections on the states, from the state's perspective, are going to be less, because there are very high taxes, as there should be, but there are very high taxes attached to the sale of marijuana in the dispensaries. So is somebody really going to pay a higher premium, including the taxes, if they can get that from their own backyard, their own little greenhouse or their friend? I think not. I don't think it's going to be the revenue source that the state thinks it's going to be. And even if it were, the cost of administering this marijuana sales program, with the inspections that are required, with the the oversight and administration, that all comes with a price tag. There are many full-time people that will have to become a part of this new industry. It's just not going to be that much money. It's not going to be the windfall that gets Rhode Island out of the financial hole.
I hear a lot of talk about use. Is there anything in the law that's been presented about age of growers? Is there a specified age on growing?
You know what? I don't know. That's a really good question. If they specify for growing, I know for purchase you have to be 21. It's the same as alcohol and now tobacco in Rhode Island, which is many people don't know, but tobacco is also over the age of 21 to purchase. I suspect it's probably 21 for growing too. And if we know anything about 21-year-olds, that's pretty young to be so responsible. And I'm just making a stab at that because I don't know the age for growing.
We currently have a social host law in Rhode Island for alcohol. Does it currently include marijuana? And if it doesn't, do you think that will change, or are there plans for it to change if marijuana becomes legal?
Yes. One of the interesting things that the prevention experts are dealing with right now is having one foot on the side of the fence that says no legalization of marijuana. We do not want it. It's not good for our kids. It's not good for our state. And then we have one foot on the other side of the fence that says, in the likelihood that marijuana will pass, we need to have some safeguards, guardrails in there so that we don't go off the track. And that's one of them, Polly, that we've been talking about. We need to get that social host law, and the social host law for alcohol primarily states that an adult who is responsible for a property, their house, their yard, whatever, is liable for if youth use their property for use of alcohol, they can be held liable. So, you can't be a parent in your bed asleep and your kids and their friends are drinking in the garage and you're off the hook. No, social host says you are responsible for that property and the behavior that's happening there. For alcohol, Rhode Island has had that for some time. And there are penalties associated with it, et cetera. For marijuana, because it's not a legal substance at this point, it hasn't been added, but there's a lot of conversation about how to get it added. One suggestion is that prevention specialists and their coalitions work at the local level. So getting it into local ordinances, and then, sort of at a certain point, there's that tipping point where you say, half of the communities have local ordinances. We just need to make this a state law. In Rhode Island or in Newport County, we know that Middletown has part of their local ordinances includes marijuana in the social host ordinance. But to my knowledge, the other Newport County towns do not have that.
Do you think it's, in your opinion, do you think it's beneficial for each other Newport County town to follow like in the footsteps of Middletown when it comes to social host ordinances?
Yeah, I do. I think that whatever we can do as a county to engage our communities in making these forays into protecting our kids from marijuana use, especially in the light that it may be legalized here, I think they need to do that. So it's the social host piece, but it's also, do we want marijuana retailers in our communities? The plan under the bill that is under consideration by the General Assembly will provide for, I think it's 25 licenses in the first year, an additional 25 retail licenses in the second year, and in the third year, another 25. So 75 retail marijuana licenses in 3 years. I think our local communities need to decide, is this what we want? Do we want it? There is some question at the moment whether if there is a moratorium on that in a local community, does that overrule what the state law might be if somebody wants to have one here? There's some question about that, but at least the towns or the cities will be saying, hey, not for us. I really applaud the city of Newport, who has been working on this very issue for a while. And their current moratorium is, no retail marijuana in the city of Newport. They've done this sort of in 6-month increments. Most recently, they did that in November. They're saying a couple of things. They're saying, we don't want a marijuana store in our town. We just don't. It's not good for our kids. We don't want to be a marijuana tourism spot. And let's face it, we know that Newport is a hub of recreation and tourism for the state of Rhode Island. They don't want to become a marijuana tourist spot. And the other really big factor that they've been considering is the high number of people who work in the Department of Defense or the defense industry. We are surrounded by Navy contracts. We are, we have an amazing naval base here, Navy Station Newport, with the Naval War College. We've got very large, lucrative Department of Defense contracts here. It's the #1 employer with the Department of Defense is the #1 employer in Newport County. And I think it's #2 in Rhode Island. So big issue when you have young people or adults, applicants who cannot pass a drug test for marijuana. You can't pass that drug test, you cannot get that job. So Newport is looking at that as like, this is a huge hit. If we can't get enough eligible applicants that could pass a drug test, qualified to take on these Department of Defense jobs, they're going to pull out. They're going to take these amazing jobs and go elsewhere. There's already been a conversation about that at Quonset Point, that they're having a struggle getting enough qualified applicants for the positions that are available. So Newport's saying, we don't want to do it. We want to protect our kids. We want to protect our very important defense industry. And we don't want to be a tourist spot for marijuana. And so they're building in those local laws, local ordinances. The state may come around and say, oh, no, we're going to do it this way. But at least they're putting themselves out there to say, not for us, not for Newport.
Currently, there seems to be a lot of confusion around marijuana legalization and the connection to youth use. A study that continues to be referenced from 2019, a study published by Gemma Pediatrics, postulated that youth marijuana use may actually decline after legalization for recreational purposes. What are your thoughts on marijuana legalization in general? And do you think that legalization will lead to the decline of youth use?
It has, my thoughts are one thing, but I think the evidence is what's most important here. And the evidence has shown that in those states that have legalized, the rate of marijuana use has gone up. There are several reasons for it. I mean, there are multiple reasons for that. One is increased access. And one is also, community norms. If more adults are smoking or using marijuana, then it becomes normalized in their community, and kids grow up seeing that. And then the barriers or the things that would maybe inhibit them from using marijuana are minimized. And let's face it, without legalization, there are enough kids in Rhode Island using marijuana. The numbers are that at least a third of our high school students have used marijuana in the past. The 30-day use, which is what we usually track, is around 20%, 25% of all students in 9th through 12th grade are using marijuana. That's a high proportion. So if we think about adding increased access, legalization, change of community norms, more advertising, no, we're not going to see a decrease in youth use.
People often assume that legalization will lower access. Do you think that's accurate?
No. And as I mentioned before in a previous question, it has not decreased access in any of the legal states. What we know from alcohol and tobacco is that the highest density for those retail outlets are in communities that can least afford to have them. So they're in our least affluent communities because they're not necessarily organized to fight against having these places involved. One of the things that we talked about with Newport was they weren't going to put a pot shop on Bellevue Avenue. It just wasn't going to happen. The people that live and work there would fight against that mightily. But there are other neighborhoods and streets in Newport where perhaps the neighborhood is not quite as organized to fight against it, or that the decision makers weren't quite as concerned about, how that would be. And I don't mean to pick on Newport, but this is the conversation that came up. No way are we going to put this marijuana retail in a place that can least afford to have it be a drawing card for people who are, who are interested in purchasing marijuana.
In the 2020 Rhode Island student survey, students were asked if they agree that people are at risk harming themselves physically or in other ways if they use marijuana once or twice a week. Only 45% of the responders agreed. Why do you think the perception of risk is so low for marijuana among youth?
I think there's a number of reasons. one of them is the mixed messaging that kids are receiving. Hey, it's going to be legal, right? Oh, it's medicine. So if the doctor prescribes it, it must be okay. And just as a point of interest, it is not able to be prescribed. A doctor can recommend or acquiesce to the use of marijuana and write a doctor's note, but it is still not a prescription. But kids hear that. They are driving with their parents or otherwise on the highway, seeing billboards for marijuana use in our neighboring state, thinking, well, this is just another thing. They hear from their peers who may sort of glamorize it. They hear from popular culture, so cool, it's really just the cool thing. One of the things that they hear is, hey, it's natural, it's a plant. Well, okay, poison ivy also being a plant, you wouldn't want to ingest. So I think what they're not hearing are some of the facts that have an impact on them. And I think the key piece to them, for them to understand, again, it goes back to the just say no. If we're going to tell kids about the risks associated with marijuana use, we need to be straight up with them. They need to understand that if you smoke marijuana or you ingest it in an edible, like, your life is not going to fall apart tomorrow. It just is probably going to be a pleasant experience to start with. And yet, there are all these things going on behind the scenes that you don't know about. And having an understanding for kids as young as early, late elementary school, they have to understand a little bit about their brain and how their brain is developing. We tell them to drink milk because it's good for their bones and, all this stuff. But we don't often tell them what to do for their healthy brain. We need to be talking about that. The kids are, people, human beings, brain development lasts until approximately the age 25. The reason that alcohol use is at age 21 and marijuana will also be 21 if it was legalized is that that's where we thought by that point we thought the brain was done developing. What we know now is that it's even later. How do we know it? Because science tells us. MRIs, brain scans. There are fascinating studies with, all kinds of technology that can show you the parts of the brain that light up, that are still developing, and how, I don't know how they do it. One of your Totally Preventable podcasts, maybe you could find an expert on this, because it is pretty fascinating to think about. The part of the brain that's developing is that prefrontal cortex during those teenage and young adult years. That's like the control center of the brain. That is the higher level functioning of the brain. If you impair that when it's developing at its highest rate with a substance, any substance, marijuana specifically, you may be doing yourself long-term damage, an impact on your brain that may or may not ever be recoverable. I think kids can handle that. I think kids can understand it. We know for sure, based on data, that the later person waits before using a substance like marijuana, the less likely they are to have long-term damage, number one, and number two, a lifetime of whether it be addiction or dependence or even problem use. So for parents, for kids, it's okay. If you're going to smoke marijuana, let's just wait until your brain is done developing. And then, at 25, if you choose to pick it up, that's an adult decision. Being a little jokey there too, I wouldn't go encouraging anybody to start at any time. But if we can help kids to hold that off as long as they can, and for it to be based on brain development, I think we can go a long way to helping kids understand that this is more important than just your parents don't want you to do it.
And we've been talking about smoking marijuana, but also around access. What are your concerns about edibles and youth?
This is a very serious topic. Just in the news within the last few weeks, there was a news article about several middle schools, maybe I think it was elementary school students in Rhode Island being taken from school to the hospital to be checked out because one of the children had distributed marijuana laced gummies. Kids are going to eat candy if they find it. I know the kids that I grew up with, or, the kids that I raised, they, you find candy, you think it's a safe thing. There's a double whammy here with the edibles. So they're very appealing to kids, as are some of the baked goods, cookies, brownies, the marijuana infused sodas. They are very appealing. Oftentimes they have colorful wrapping. They look like products that we use. There's actually been a lawsuit about copyright infringement because they look so much like the products that we would recognize, that that there's a problem with the copyright issues. So they look like common delicious products that would appeal to children. That's bad enough. The other part of that is the marijuana dose that is contained in a very small concentrated product. So the standard one dose of marijuana edible is 10 milligrams of THC. In the case of some of those gummy products like gummy bears or whatever, one gummy bear might have that full dose of THC. So I don't know about you, but one gummy bear is not going to do it for me if it's a regular traditional gummy bear. Serving size seems like it should be the bag. A young child or a child or anybody that doesn't know that they're getting something that's infused with THC could very easily eat far more than the recommended dose in a very quick time frame.
The youth mental health crisis continues to escalate and often goes hand in hand with substance abuse. We hear often from teens that they turn to marijuana to relax or de-stress. What advice do you have for a parent or a teen dealing with this type of situation?
That is such a challenging issue because, again, on the one hand, seems like it works for kids. They think that, boy, I feel better. I'm not as stressed out. I'm not as anxious. But what is really happening is that while they are using marijuana to, in their mind, treat anxiety or depression, they're really masking those mental health concerns. They are maybe feeling better temporarily. It's relaxing and maybe distracting. And then what happens afterwards is that when you're not under the influence of the drug anymore, look at that, it's still there. The problem is there, the stressor is there. I still don't feel great. So let me go back and feel better by using this substance. So that's a vicious circle. So there's, feel better, use again, feel better, use again. And then what's also happening with that is that marijuana, there's a lot of studies right now. I haven't seen any that say it absolutely causes depression or it causes anxiety. It certainly doesn't treat it, and it certainly doesn't help in the long run. But there is a lot of evidence out there through medication studies and research about the risk of psychosis associated with long-term marijuana use. And it seems to be worse the younger you are when you start using marijuana. So it's also been connected with schizophrenia. It causes a higher than average rate of schizophrenia in users who began using at a younger age. Not worth the risk as far as I'm concerned. I think one of the important things to also remember is that while a young person might be getting a little bit of relief from whatever they're feeling, kind of they're getting numb from whatever they're experiencing, marijuana use is becoming their coping strategy. That's how they're coping with stress, coping with frustration, coping with whatever. And in the meantime, they're not developing a healthy coping strategy. They're not developing strategies that are going to help them long term in their life. We're going to have stress in our entire lives. Things are going to happen. They're going to put us off our game for a little while. We need to, as human beings, develop strategies to deal with that help us to get through the moment so that we can get to the next step. Using a substance, whether it be alcohol or marijuana, that becomes the coping mechanism of choice. It's easier than doing the hard work to develop those other skills. So I think for parents, for youth, for kids looking at their peers, it's why we talk so much about recognizing the signs of distress in other people. If you have a friend who they just don't seem like themselves now or anymore, to be able to do that outreach and say, hey, Greg, I've been noticing something seems to be up. You just don't seem like yourself. Are you okay? And having that conversation, there are great skills to learn to be able to have that conversation, whether it be with your peers, with your child, with your parent, whomever, to be able to develop that as a mechanism. And then when you get, especially if you are a peer to someone who you think is experiencing some trouble, to be able to recognize it, ask about it, and say, I think you need to get some help. I think you need to talk to someone. All of our middle and high schools have a student assistance counselor. That's an excellent person to talk to because they're specifically trained to work with kids around substance use issues and concerns. But a trusted teacher, another trusted adult, maybe it's a coach, it's somebody that kids are comfortable to go to and say, I'm concerned, I'm seeing this, I've talked to them, they're not willing to get help, or hey, maybe they are willing to get help, and I'd like to be a part of, getting that conversation to happen. A couple of things to think about, and this is so hard for a kid, but it's truly very difficult for a parent as well. That person may be so angry with you for reaching out and trying to get that help, but we have to go back and think, we just might save a life. That is one of the most difficult things to do, having those conversations with somebody else at the risk maybe of violating the confidentiality or maybe of violating the friendship a little bit. The hope is that long term, the person says, hey, thank you. I know you didn't do it to be a jerk. I know you didn't do it to like rat me out. You did it because you cared. That would be a great outcome. But if that doesn't happen and you truly think that you have made a positive impact, then that's got to be good enough to think, but for the action that I took, maybe that person would have found themselves in some real trouble, either with drugs or self-harm, suicide, whatever it might be. We have to empower ourselves, we have to empower parents, and we sure have to empower the kids to be taking that approach.
Rebecca, what advice do you have for parents about talking about marijuana? I know I often hear that parents don't know what age to start, or they think talking about substances is going to lead to experimentation or more questions that the parents can't ask. Do you have any advice?
First thing is, talking about it is not going to lead to experimentation. When we hear that a lot. If we tell kids about the truth about something, they're going to go and do it. That is not the way the adolescent brain works. What we need to be doing, though, is making sure that we're giving them facts. I said previously, Just say no does not work. It never did. It certainly doesn't now. Kids are very sophisticated. Kids have access through their, their little devices. They have access to the whole world of information. I think parents need to prioritize that information is coming first from them. The parent is responsible. They're the primary teachers. A longtime colleague of mine says there is nothing more powerful in prevention than a parent. And that is absolutely the truth. All of the community programming, all of the school education, everything, even peer pressure, the most important thing is for that parent to start those conversations at a young age and continue. At what age is always a challenge for people, because they don't want to scare their kids. They don't want to plant a new seed in their head. What if the kid doesn't know about it? Well, chances are the kid knows about it before you think they do. They've heard it, they've seen it, it's been on TV or in a movie that they saw or something. They've got a little kernel. Kids talk about this amongst themselves at a very young age, far younger than most parents would think. Like with the stove, we do not wait for our kid to be reaching for the stove before we say, don't touch, it's hot. From this moment they can waddle themselves into the kitchen, we start telling them not to touch the stove, it's hot. The same thing goes here. As soon as they can understand little pieces of this, we do not have to talk to them at 7 years old about the risks of opiates. What we can talk to them about at 7 years old is not putting anything unhealthy into their systems. We want them to eat well, be healthy in that way. We start to talk about certainly smoking at a young age. It's not safe. Tobacco is not a safe product for kids. Throw marijuana in there. We need to be careful about what we're role modeling. And I want to be careful to say, I'm not saying that adults cannot, legal age adults cannot drink alcohol or can't drink alcohol in front of their children. But let's think about what they're seeing. Healthy attitudes toward alcohol are not harmful to children. Healthy attitudes include, having an adult beverage as part of an enjoyment in the day. But when we start doing things like, oh my God, I had such a tough day, get me my, I need my wine, or, lots of memes were out there during COVID, during the time when kids were home. I learned new words like day drinking, and a lot of those types of things. They're funny. They're meant to be humorous, adult to adult. We can smirk at it or say, yeah, I know what you're saying is tough right now. But when those attitudes become part of our language, they spill down to our kids. They hear it. They hear it and they understand what it means, but they don't necessarily understand the context. It's a joke. Oh, let's hope it's a joke. But that becomes part of that child's thought process. So with parents, a couple of things. I know back when we used to spend a lot of time talking about tobacco. Now we talk a lot about vaping. But with the tobacco, I remember having parents say, I smoke. How do I tell my kid not to smoke? Very easily. I drive. My 10-year-old can't drive because it's not legal, it's not safe, they're not ready. That's where we throw in that brain stuff too. If we are able to say, adults over the age of whatever drink alcohol because their brains are fully developed. It is not going to cause damage to the developing brain. You, my 15-year-old, your brain's developing. And we do not want your parents do not want you to have an impact or be impacted by brain development use of marijuana. The other thing is for parents, really know the facts. And I don't mean the facts that are put out there on the internet by the marijuana industry. I mean, look for science. NIDA, NIDA is the National Institute of Drug Abuse. the CDC, they have good information. Look for some real facts. One fact is that statistically, youth that use marijuana in high school have a much higher percentage of not graduating high school and not going to college. That's a fact that a parent can say to an up-and-coming kid. Hey, you know what? This has an impact on decision making. It has impact on your brain. And here's an interesting thing. Kids are less likely to graduate high school and go to college if they're using marijuana. Those facts are out there. If we use scare tactics, never going to work, because for every scare tactic you can throw out, that kid knows 100 examples of how that's not true. So we can't exaggerate. Your head's not going to fall off if you smoke marijuana, but you are going to have impacts. There are things that are going to happen. Parents need to get more comfortable with those conversations and start young. Every opportunity you get to talk about safety and, again, you don't have to talk about the big, bad, scary stuff, but talking about not putting things in your body that might be harmful. That I think is really my best advice.
What are some other unintended consequences that you feel marijuana may bring? The legalization of marijuana may bring?
Yeah, so there's a lot, and I think it's split in my mind between things that are unintended consequences on the individual and unintended consequences on the community. Individual and community, the likelihood that there will be an increase in driving under the influence of marijuana. At the moment, there are some technologies out there that are being studied in terms of being able to prove somebody's under the influence of marijuana, but they're very challenging. So unlike a breathalyzer that can pick that up immediately, it's going to be some time before there are ways to really prove that somebody is under the influence of marijuana while driving. So that's an impact. That's a public safety, law enforcement impact. It is not going to be as lucrative as the state thinks it is. It's not going to bring in the revenue they think, and the costs are going to be much higher than anyone anticipates. The impacts on, we talked about it before, the impacts on industry and jobs. There's a lot of talk among the pro-legalization folks about how this is going to bring great middle earning jobs. It is not going to bring great middle earning jobs. Some already wealthy guys or ladies, people, are going to make millions. Just like big tobacco, you got big marijuana, someone at the top of the food chain is going to be making big money. There's no middle in there. And then there's the folks that are going to maybe be working at retail. Retail is retail. Those folks are not going to be making the windfall. The state's not going to get the windfall either. So when we think about where the money's going to be made, money is going to be made for sure. But it's going to be the folks that are at that corporate level of marijuana business. Another thing is about what does our community look like? That connects with the advertisements. Are we going to walk down every city street and see advertisements for marijuana? All of that. The billboards are already in Rhode Island, and those are only benefiting our neighboring states. So, what are the regulations going to look like around advertising? And commercialized marijuana is what we're really talking about. And the high potency products, I think, is the piece that may be the most troubling, because the potential for having high levels of THC consumed in a very short time, that is a really, really big concern. For millennia, people have said, oh, nobody dies from marijuana. Well, it's only recently that marijuana concentrates have been at levels that they're at so much higher. Some people say in a joking manner, this is not your grandfather's weed. No, it's definitely not. It's not. When marijuana when a joint was maybe 2% THC in the day, and now the consumable, the edible marijuana can be 45, 55, 65% THC. And then the concentrate products that are being created, that you may have heard of, things like dabs, shatter, butter. Those are processed through the use of a solvent like butane. It's this whole chemical process to get nearly pure THC. If it's, so for example, wax, the tip of a pin, a straight pin, may have just the tiniest little bit that you heat up, inhale, and you're inhaling THC at a percentage level that was, a few years ago, absolutely unheard of. We don't know what's going to happen as those products become more and more accessible in the regular common marketplace. It appears that in some states, those high potency products are being limited. They can't be sold in retail places. But we'll see, and we'll see what Rhode Island does. I don't know what their proposed limit is on potency, but they need to have a limit on potency, because the data is just not there to say that it's safe.
What would you say to adults and youth that say they're better drivers, they're more focused, they can do more focused activities while they're under the influence of marijuana?
I would say that is not true. We know some things about marijuana. Marijuana impacts reaction time. Marijuana impacts concentration in a negative way. It does not improve concentration. And it also affects coordination, and it doesn't improve it. It takes away from your coordination. So just even if it was just one of those aspects that affect, in driving was affected. If you think about reaction time, the ability to stop, the ability to turn, the ability to avoid an obstacle or a pedestrian in your way, critical pieces of driving. And to think that someone would put something into their system and make them better, just really shows a level of being naive that, I often even wonder, do they really believe that? Or is it just something that they say? We know with younger drivers, they believe it because they are probably feeling as though they're driving more cautiously. But unfortunately, there are motor coordination aspects that they're not aware of. They're under the influence of something. They're not aware that even a half a second of delay in reaction can have devastating impacts while driving.
Well, Rebecca, we want to thank you for taking time out to be on our Totally Preventable podcast. Would you like to give out your handle, your website for more information?
Sure. So you can find us at Newport County Prevention Coalition at newportcountyprevention.org. We are also on Facebook. You can find us by going to Newport County Prevention on Facebook.
Great. Thank you. It's been a pleasure.
Thank you, Polly. Thank you, Greg.
If you would like to learn more about marijuana edibles or tips about talking to your teen about marijuana, you can visit our blog at www.newportcountyprevention.org/blog.